Hello, welcome back to part two of Let's Ask ChatGPT or AI about medical questions and see what it has to say. If you aren't familiar with this, go back. I'll put the link in the comments and watch part one. I ask ChatGPT or AI as a physical therapist with actual hip pain what I should do about my hip pain. And then in this video, we're going to ask ChatGPT or AI as a patient. I'm going to ask questions like a typical patient would over my years of practice and see where we go. So let's get started. So it asked me where I hurt, and like a true patient, I told it basically it hurt everywhere, deep inside, on the front side, maybe in my groin. I don't know when it started. I just know I can't run anymore, and every time I try, it hurts. So it went through, and it number one on the list, it was a hip labral tear, impingement or hip flexor strain, pretty on par, or even a sports hernia. Give me some advice on what to do. Give me some red flags of when I should go ahead and get an extra evaluation. And it asked me if I wanted some simple at-home tests, and this is where everything fell apart. So it told me some actual special tests to do for my hip. It described them for me, which I can tell you there is not a single patient on the planet that could read through this and know exactly what to do. So at the end of its suggestions, it asked me if I would like a diagram, and I said sure. And the funny thing is, it took it about a day and a half to come up with the diagram. And the diagram was halfway decent, but really not even in the ballpark. Maybe out in the parking lot or somewhere close to it. So I looked to see if there was anything else, and there really wasn't. So as a patient, I would say it really didn't hit the mark quite like it did whenever I was asking it questions like I was a PT.